Hello, my name is Nurse Guy, and I'm a community nurse from Changi General Hospital under Sing Health, and I specialize in community health. My role is to help manage chronic diseases as well as prevent illness in the community. So come and join me as I meet my patient. Today, I'd like you to join me on a home visit. We will be visiting Madam Yati, a 58-year-old Malay lady who has diabetes, hypertension, and a history of falls. I like to check how she manages her chronic diseases as well as performing a home falls assessment and prevention. We're also doing a well-being check and a home environment as well. Hi.
So,
Selamat pagi Cik Yati. How are you feeling today?
I am doing fine, Alhamdulillah.
Good to hear that. So let's get started by assessing your vital signs first. Can you extend your arm out for me?
Okay.
Your blood pressure is really good today. I'm very happy to see that it's well controlled.
Thank you.
Okay. Here's a quick question. Do you know why it's important for us to find out what our patients eat before we check the blood sugar? Okay, so it's important for us to know what our patients eat before we check their blood sugar levels because it gives us an insight into how their diet impacts their blood sugar levels. So from there, we are able to give them good dietary advice and to give them accurate treatment so that our patients can better manage their condition. Madam Yati, before I check your blood sugar levels, may I know when was your last meal and what did you eat?
I had my breakfast around an hour ago. I ate 2 half-boiled eggs, a piece of bread, and some tea.
Okay, good. So before I proceed to checking your blood sugar levels, I will need to ask you whether it's okay if I check on the side of your fingers just to draw a small drop of blood. Is that okay?
Okay.
Okay, can you give me a moment while I prepare my device?
Okay.
Can I have your finger, please?
Yes.
Okay. Okay, breaking in 3, 2, 1. Okay. Squeeze for me, please. Okay, your blood sugar is within a normal range. Good job.
Thank you.
Here's another question. What are some things we will ask when checking in on our patients? In fact, we check on all of the above. It's important that we ensure the 5 rights. The 5 rights are right patient, right dosage, right medication, right route, and right time. Madam Yati, I can see that you're taking both losartan 50 mg and valsartan 50 mg. Can I ask when do you start to take valsartan?
Yes, I got it from my friend, and she is the one who recommended it to me.
I understand. Are you taking both medications now?
Yes, I thought it would help me keep my blood pressure in check.
I can see that you're taking extra steps to manage your blood pressure, but it's important to be extra careful when you take these medications. Both these medications are for blood pressure management and belong to the same drug class. Okay, when you take these medications without doctor's prescription, it can lower your blood pressure by too much, causing dizziness and other problems.
Oh, I thought by taking both, it would help better in managing my blood pressure.
It's good that we caught this mistake early. I suggest you stick to the medication doctor prescribed to you.
Oh, I got it now. Thanks, Ms. Ghair.
You're very welcome. I'll put it in the health records. In the meantime, if you have any questions in future, feel free to ask me.
Thank you very much, Ms. Ghair. I really appreciate your help.
You're very welcome. I'm glad we sorted out your medications. But I would like to ask, have you been able to stay active lately? Because being mobile is important for your health.
Oh, don't worry about me walking. I've been running after my cats all this while.
That's what worries me the most. Please don't run after your cats. On that note, can I ask if you're okay with me doing a short fall assessment for you today?
Sure.
Before that, why do you think it's important to perform a falls assessment on patients like Madam Yati? Exactly. Fall assessments help us identify risks and take preventive measures to ensure patients like Madam Yati can move around safely and confidently. Madam Yati? That's partly true, but it is more than a routine check. Falls can end up in fractures, decline in functions, and increased care needs. That is why it's important to provide targeted advice and interventions to prevent future falls. Come, Madam Yati. Okay, let's get started. I will give you clear instructions on what to do during the assessment. But don't worry, I'll be beside you every step of the way. If you feel unsteady, you can always hold onto my arm, okay?
Okay.
Okay, come. Okay, I need to hold onto the chair beside you and lift your right leg. Okay, you can let go. Oh, okay, come. Let's have a seat. Okay. I need to do some blood pressure check just to see if any partial hypotension. This may be linked to hydration, medication, or circulatory issues. Is that okay?
Okay.
Okay, I need to extend your hand out for me. It seems that your blood pressure is a little low. Is it okay if I get you to drink a bit of water? In order to stabilize your blood pressure again, I will need to do some seated marching in order to get the circulation to move again before we recheck your blood pressure again. Okay?
Okay.
Based on the assessment, it seems that your single leg stand was not steady. This means you are at an increased risk of falling in certain situations, such as when you're wearing your pants, going down the ledges, or going down the stairs. Okay, so I would like to give you some safety tips to prevent falls, as well as enlighten you on some community services that we have, such as day rehabilitation and home rehab services. I'll put up a referral for you. In the meantime, is it okay if I take a look around your house to see whether your home is a safe environment?
Sure. Okay.
Okay, so in the living room, I can see that the furniture layout is actually quite good because you have a very wide and open walkway. Okay, and I can see that the standing fan, the wires are quite, this reduces the risk of you tripping over them. Good practice, continue that, yeah? But the sofa, I feel it's a little low. You can add some cushion so it's easier for you to stand up when you sit down. Okay, come, let's walk to the kitchen. Okay, so I can see that utensils actually very within reach for you. There's no need for you to tiptoe. Okay, but down here, I can see that the furnitures can be pushed more to the wall, so you have a wider walkway for yourself.
Okay.
Okay, okay. At the entrance of the toilet, I can see that you have a very good anti-slip mat here, but I advise having some more spare so you can use it when you wash this one. Okay, come, let's go inside the toilet. Okay, in the toilet, I can see that grab bars where you have the toilet bowl. This is good because it helps you to stand up. Okay, And in the showering area, you also have installed grab bars. So this helps you to stay steady when you shower yourself. Okay, but the wire over here, I would advise you against coiling it and putting it at the wall, because in the event of a fall, you can reach it from the floor if let's say you need any help. Okay, so I advise you not to coil it up. Okay, do you have any questions so far?
That was a very thorough check. Thank you for the advice.
It's my pleasure. It's part of my service to be thorough when I check your home and you. That's my usual routine as a community nurse. What do you think? Thank you for the kind words. It means a lot to me to know my efforts are being appreciated. I get to provide support, empower patients and caregivers, and make a difference in their lives. That is what makes nursing meaningful and motivates me to do my best. If you have a similar calling, come, explore nursing with us.